Assalamu alaikum. Starting the name of Almighty Allah, who is the most merciful and greatest. Students, Assalamu alaikum. Today I am going to discuss the topic of malfunctioning of kidney. As we know that kidney plays important role in our body. From important means kidney play role in the cleaning of blood. That we can also say that the nitrogenous waste and other non-useful materials or the toxic materials that are not useful for body and they are toxic for the human body and they have to eliminate, and their elimination is done by kidney by cleaning of blood. So students, today we are going to discuss the malfunctioning of kidney. For malfunctioning means that an organ is unable to perform its function, and in case of malfunctioning of kidney means the kidney is not proper functioning or in not its healthy condition. So it's point to remember that kidney disorders are not stationary. They can be affected other parts of the body as well, because in the beginning of the chapter, in the very beginning, I tell you that all the functions and all the systems of the body are coordinated with each other and they are connected with each other for the proper functioning of body. So in case of kidney is also related with and also connected with other functions of the body, that it clean the blood but then it sent the clean blood to our body. So from this we mean that kidney is also connected with the heart, also have linked to our blood, and also linked with the digestive system, also linked with the other systems of the body. So we can conclude that kidney is not a stationary organ, because its main function, it is playing the main function in the body, that it eliminates the non-useful and the toxic materials from the body. So whenever a kidney is damaged, then it is understood it will damage the other organ and it will affect the other systems of the body, and then the body will never work in proper conditions. Whenever kidney is damaged, then they will, and these kidneys will be affect other organs. So now we are going to learn how these organs are affected and how a kidney is become affected, and when we say that kidney is malfunction. So students, it's understood that from malfunctioning means that the organ is not in proper condition. So there are different conditions when kidney is working abnormally. The first from them and the most common disorder of the kidney is the kidney stone. And students, in kidney stones, kidney is unable to perform its function properly and actively. So kidney stones are formed by different ways. From these ways, the most common way is to eat excess of calcium and calcium containing foods. So students, what do you mean by kidney stones and how they are formed? Kidney stones are actually the material that is in excess amount in the body. For example, we say that if a person is eating excess amount of foods that are rich in calcium, then this calcium will be used in the formation of her bones and will be used in the formation of other organs and we use in blood. And whenever this calcium is excess in amount, although calcium is used widely in our body, but whenever we use excessive food containing calcium, then it may be in excess amount. Then whenever it is abundant in its form and it will be and it is in excess, then therefore they started to be accumulated. And when blood comes in the kidney, then kidney is performing its function during the cleaning of the blood, there will be the excess of calcium. When calcium is in excess, then calcium started to be accumulated in the kidneys, and this accumulation of calcium and other salts appear a structure known as stone. So students, this is the main reason of formation of stone, and this is the main concept of stones, that how stones are and how kidney stones are formed and what are they actually. So when a stone is formed in the kidney, the question is that what will they and how they behave in the kidney, that they are painful. So students, when kidney stones are produced in the kidneys, especially they are formed in the calyces region and known as a calyceal stone, and sometimes these stones are formed in the pelvic region of the kidney, which we call the renal pelvic region. Then the stones are known as the renal pelvic stones, and sometimes these stones moved ahead and become stayed at the urethral region, so we call them the urethral stones, and they may be in the and they may be moved to bladder. So on the basis of regions, these stones are characterized and these stones are named according to their regions where they are present and according to the type of material from which they are formed. So, in such situations, when salts are accumulated and kidney stones are formed, then these stones starts to pain because these stones disturb the normal functioning of the kidneys, and whenever they disturb and they cause the pain, and they will ultimately cause the infection due to the damage of the kidney, because bacteria are present and these bacteria act upon it and cause the infection. So kidney stones maybe travel, and whenever they travel to ureter or the urinary bladder, they may be the cause of stoppage of urine. And the common cause of stone in kidneys is excessive calcium and calcium salts. So students, we learned that kidney stones are formed, and also learned that kidney stones accumulate in the kidney, they are disturbing kidney functioning. So now we are going to learn that whenever they are in excessive amount, what they will occur and what they will do in the kidney. So students, whenever these kidney stones are becoming excessive amount, or they are disturbing the major functions, and they start to disturb more and more kidney functions, so they may cause the renal failure. From the word renal failure means the failure of the kidney. From the failure means completely or partially stopping of kidney functions. So the word renal failure is the complete or partial failure of kidney to work. And we know that the main cause of the renal failure is the long term infection. And we know that the long term infection may be and this infection may be caused by the stones damaging, and that the damaging of the stones, whenever these stones start to damage the kidney, and they may cause the infection. So we are going to learn the renal failure causes. So the main causes include long-term infection, diabetes mellitus. So students, what do you mean by the diabetes mellitus? Diabetes mellitus, in our common language, we call it a sugar. And in diabetes mellitus, the sugar level become high and remain high in the body. And due to this, kidneys become fail to perform their function. And also the main causes of kidney failures includes the hypertension. From hypertension we means the high blood pressure of the body. And now we are going to discuss the treatment of malfunctioning of the kidneys. So students, whenever the kidneys are fail to perform their functions and they are fail in their proper functioning, so a person who is treating this disease and this condition is said to be a doctor and a kidney specialist. So kidney specialist will first check the cause of this blockage, and first check the causes and then check the situation and check current situation of the kidney. Then after checking this reason of blockage, and after checking the current position of the kidney failure, then they will prefer to dialyze the kidney. So dialysis is the treatment of kidney failure, and other treatments may include kidney transplantation and maybe the surgery. So students, what do you mean by the dialysis? What do you mean by kidney transplantation and from surgery? So let me explain what is dialysis. Dialysis is the artificially cleaning of the blood, and we know that in our body the cleaning system is controlled by the kidneys, and when our kidneys are failed to perform their functions, then and a doctor do dialysis. And dialysis is the artificially cleaning of the blood, and this cleaning of the blood is done by a machine known as the dialyzer, and the process is known as the dialysis. And the second thing which I told you, that the treatment of kidney failure include kidney transplantation. Kidney transplantation means to transplant. Transplant means to replace a failed kidney, or to replace the damaged kidney with the healthy one. And the third one that I told you is that the surgery. Surgery means to cut out of the kidney, and the doctor remove these stones by surgery and by cleaning with operation. Okay, now how the kidney stones can be removed. So students, there are different types and different size stones may be present in the kidney. The treatment can be done on the size, shape and the type of kidney. So the physician can be judge the type of treatment and can judge the and will refer the treatment and a type of treatment according to the condition and according to the type of the kidney stones. So whenever there are smaller size stones, then the physician will prefer a patient to drink excessive water. By drinking of excessive water, the small sized stones can be removed, and these small size stones are moved ahead with the water. And whenever the stones are of medium size, then the physician will prefer to be done the lithotripsy. And now the question is that what is the lithotripsy? Lithotripsy is a treatment in which there are high intensity waves are used, which we call the shock waves, and these high intensity shock waves are bombarded, and by the bombardment of these high intensity rays in the shock waves, the stones are breaked, and due to their breakage, stones become in the smaller size, and after becoming smaller size, they are moved ahead in the bladder, and with the urine they are expelled out from the body. So the students, we have another type of stones that are extra large size stones, and these stones cannot be passed by the urines, and they cannot be treated with the help of water, and they cannot be treated with lithotripsy. Now these are treated with the surgery, that the patient is operated and the physician will remove the stones with the surgery. Okay, now we are going to discuss a condition whenever there will be no chance of treating kidney, and we have no chance to uh, cure the kidney. A condition whenever we have no chance to treat the kidney, then we have option to remove this kidney, means to transplanted kidney, and we also have a chance, or we also have a way to clean this kidney and to clean this blood artificially. So this method is known as the dialysis, and we know that dialysis is the cleaning of blood by artificial method. So this cleaning of blood by artificially is known as the dialysis, and the machine with the help of which we are doing dialysis is known as the dialyzer, and the blood is passed through the dialyzer, which is and the process is the dialysis, and the fluid is known as the dialysis fluid. First, the blood flows through the tubes of the dialyzer. That we know that here the two type of tubes are attached with the body. From one tube, blood flows through the tubes towards the dialyzer, and the dialysis fluid. And this is the dialysis fluid, and this dialysis fluid surrounds the tubes, and here dialysis fluids surround the fluid. Students, you can see that here in bluish color, light blue color, or we can say it a sky blue color. Here the sky bluish color fluid is known as the dialysis fluid or the dialysis or dialysing solution. So this solution accumulate the dialysing tubes, and these tubes surround the, and these tubes are surrounded by the dialysing solution. So after that, this solution removes the toxicity of the blood. So how they remove the toxicity? Uh, because they remove toxicity in this way that these tubes and the tubes which tubes the dyes and the tubes that contain the blood are semi permeable, and and semi permeable means some are, and semi permeable means to permit some of the fluid in and to permit some of the fluid out. Okay, due to this semi permeability, we call it a semi permeable membrane. So we know that these tubes are semi permeable. Due to their semi permeability, blood with the waste products move to the dialysing solution, and dialysing solution move to the tubes that contain blood. So due to this movement, in an outward movement, the blood will be clean, and the extra material that is containing the waste material and unwanted toxic materials are become clean. And now the blood, after cleaning and after circulating in the tubes, move to the body. Okay, from this tube blood will be from this tube blood will be moved towards the body. Now the blood is clean and returned to the body, and dialysis will be done once in the week. Okay, now if a patient's kidneys cannot be cleaned artificially, or uh, the patient is not in the condition to dialyze its blood, then we have another option to care a patient, is that to transplant its kidneys, and is known as the kidney transplantation. In this method, a healthy kidney is donated by a healthy person, and then the diseased kidney or the damaged kidneys will be removed, and a healthy one is attached and grafted in the body of the patient, and this kidney is replaced with a diseased kidney. So now the question is that who will donate the kidney, and who is able to donate the kidney, what type of kidney is able to transplant. So students, the kidney must be healthy and may be the blood relative or any close relative. Blood relative means and the donor of the kidney should be the daughter of that person, should be the son, should be brother, or any father mother. Means a patient should have the donor's blood relation. Other case, if he don't have any the close relative one, so the kidney must be the same with the same blood group. After the a transplantation, then the body have its immune system, then body will be accept it. Another case, sometimes body will never accept the kidney and say it as a foreign particle and foreign object. So the students, this is about the kidneys problem, kidneys treatment, and the malfunctioning of kidney, and it's about how we will cure the malfunctioned kidney. This is the end of your chapter. Now we will, inshallah, in the next lecture we will summarize the whole chapter, and after summarizing we will solve the exercise.